look forward to retiring and constantly playing golf. But then Reginald Lewis became injured. He wasn't able to lift his arm without just cringing. Lucas underwent several shoulder replacement surgeries, but they just didn't work. And he almost really lost hope until he underwent a different type of procedure that's offered here. It's called superior capsular reconstruction shoulder surgery. A lot of S's for me this morning. Boy. All right, joining me now, orthopedic surgeon and head team physician for the Jags is Dr. Kevin Kaplan and the patient himself, Reginald Lucas. Good morning to you. Please don't make me say shoulder surgery again.
You did it good. You did it well.
All right, good morning to you guys. Thanks for being here. Doc, let me start with you if I can, because this is something, this was your first patient and the first patient in Florida to undergo this. It's actually out of Japan. How does it work? First of all, I know you've got some animation to show us, and how is it different from other shoulder surgeries?
Well, usually when we have a rotator cuff tear in a shoulder, we try to repair it primarily, and we can do that by bringing it over and attaching it with sutures. In instances where the rotator cuff either doesn't heal or it's retracted too far, it can't be repaired. And without a rotator cuff, it's very difficult to raise your arm, lift your arm overhead, and do all the activities that we all normally do. So usually what we have to do in that situation is then replace the entire shoulder with what's called a reverse shoulder replacement. This new procedure actually reconstructs, so to speak, the rotator cuff. So we use a type of graft that goes over the top of the ball and socket. And what it does is it keeps the ball centered on the socket so that the patient can then elevate his arm and lift it up over his head so that he can do all those normal activities.
And it lasts forever?
That's the goal.
As long as you're not doing major heavy weightlifting, I assume?
Correct. Well, you know, this is a very new procedure. We are now studying in patients like Reggie. We've actually done a repeat MRI on his shoulder to look at these grafts to see how they last and to see their long-term function. But the idea is to get him back playing golf and doing all the things that he wants to do.
And I know that, Reggie, you were always very athletic throughout your youth. You played baseball, of course. You coached as well. What was life like for you before, when you kind of kept injuring your shoulder? Because it's something we use every day.
Well, I was stopping an altercation at school, and I had a couple of people to do the surgery and went over to see Dr. Kaplan. And when I went in to see him, you know, he had played basketball at Bishop Kenny. Bowls against me, and you know. And
so you knew one another.
I knew what they could do. So, and he said, well, he had done a cleanup of it, and said, well, there's not really much more I can do. And then he came in, and the next time I saw him, I said, Doc, I'm in so much pain I can't sleep. He said, well, I got one more thing I could do. It says it's only been done 3 times in the world and never in the United States. I said, well, I'm a first-type person. You could do it with me. So he decided to do it, and once he did it, I mean, I had the pain block put in. The next day, you know, I had to take pain pills one day. After that, I didn't feel any more pain.
And so this was after, and so this is about a year ago then that you had the procedure. Other than not having any pain, how long did you have to kind of rehab, and what did you have to do in terms of the recovery?
He sent me out to select therapy to do my rehabbing, and he wanted me to go slow because he didn't know how it was going to work. Yeah. So I came in one day and he said, just let me see what you can do. And I lift the arm up in the air. He said, man, that's remarkable. Can I call somebody else in? I said, yeah. So he started taking pictures, and then the next thing you know, it was all off. I could go.
That is fantastic. I'm so glad that you're doing well and getting back to playing golf. Have you been able to yet?
Yes, been able to play golf, been able to work my hands, walk every day.
Yeah, that's fantastic.
Lift my arm up in the air.
We love that.
That's great. Doc, thanks for being here, and good luck with you. That's wonderful to see such a change. It's great. So you can stay up, by the way, to date with all of the latest health news, including this procedure. We're going to post this entire interview on news4jax.com later this morning. Just look under the health page, as well as under the morning show page as well.